Hello and welcome back to Partnership Live. I'm Mariekarl Vilceus-Talty, President and CEO at the Partnership, and I am here with Kiran Handa Gaudioso. We are here to speak with our New Jersey leaders that are changing the paradigm throughout Northern New Jersey. Kiran, I'm so happy to finally get to speak to you. How are you doing?
I'm doing well. Thank you so much for having me.
Kiran, you are the President and CEO of United Way of Northern New Jersey.
I am, yes.
So nice. And we're both working in the same catchment basin, really changing the paradigm throughout Northern New Jersey for all of our stakeholders. Again, so excited to speak to you. But before we get into the nitty gritty of how you're changing the paradigm in Northern New Jersey with the United Way, if you weren't doing this job, what would you be doing?
I love this question, Marie Carl. I really appreciate you kind of jump starting with something like this. But I am very glad that you alerted me that this would be a question to consider. I think there might be two options, if that's
Okay,
okay.
absolutely.
I think the first is I love to cook and bring friends and family around the table to cook. So I think I would love to have a restaurant or some sort of
Mm,
cooking school or kind of community gathering opportunity around food and kinship and family and friends. So
I
that's
love
that's
that.
one. And then growing up, I thought I would go to law school and go into the FBI. And I always
Oh,
had kind
okay.
of visions of being, an agent and, really working around public safety and traveling the world and all of that. But, I don't know that that was reality, but that was kind of my sort of coming up plan as I was growing up.
Oh, that sounds exciting. And I think that not knowing everything about you and the United Way, I'm sure you married those two things very well with what you're doing now. There's
Yeah,
some kind of thread that goes through.
yes, I think so. I
Yeah.
think so. I think, the bringing together and really creating and participating and engaging in community is something that's really important to me with my team, my board, obviously our partners here in New Jersey, across the country. And I do think, and you know this from the work that you lead, there's a little bit of that kind of Jersey girl sort of grit that you need, that probably an agent would also need to do
Yes,
this work,
absolutely.
because this can be very challenging,
It can.
personally and professionally.
Sometimes you have to dig in, absolutely. And,
Yes,
going
yes.
into that, we hear about the United Way all the time. I remember growing up looking at the commercials. Can you share with us how the evolution of the United Way and how it impacts people locally?
Yes, thank you. And you said the key word is the evolution. So United Way is a global charity, a global NGO. We have about 900 United Ways in the
Wow.
US, around 200 throughout the rest of the world, Europe, Asia, Africa, etc. We're represented on all the continents. And it really, our purpose is really to be in community and be those boots on the ground. But like most kind of federated model nonprofits that have been around a long time, every individual United Way is different.
Mhm. Mhm.
And in fact, our United Way is incredibly unique because we operate direct service programs here on the ground in New Jersey across our territory, our 5 counties. We serve about 10,000 families directly with childcare, financial literacy assistance, free tax prep, crisis. We do a lot of crisis intervention and case management. We do a lot of direct service supports for families here. We don't raise money and then distribute it to grant making. That model of United Way, community allocation model, has really, for us, has not been kind of our core business. We've really shifted in the last 20 years. And then, in addition to the work that we do on the ground locally, we also operate United for Alice, and I serve as the president of United for Alice. I have a dual role, because that is our national research and analytics project, where
Mhm.
we look at how to really capture and measure and really redefine what we mean by financial hardship.
Mhm.
And I think you obviously are familiar with the terminology, Alice, but it's
Mhm.
asset limited, income constrained, employed. It's really the households that earn above the federal poverty level, which is one number no matter where you live in the country, regardless of geography and the differences around wage and cost of living. The ALICE measure offers something called the ALICE Survival Budget, which is an alternative to the FPL, and it's more accurate, Mariekarl,
Mhm.
because it looks at local wage, local cost of living, creates something, county level budgets, so that when you're trying to understand what's happening in community and why families are struggling, you have an accurate assessment of who is in financial hardship.
Mhm.
And when we look at Alice, we're talking about families who are working and who often two and a half jobs,
Mhm.
yet struggle every week to take care of their family and pay bills.
Mhm.
And they're really right on the cusp.
Right.
One crisis, a car repair, a large utility bill because of a cold winter,
Mhm.
a crisis with a medical crisis with their child, a disability, etc. They're really one crisis away from really
Being
falling into
undomiciled.
poverty.
Right.
Exactly.
So, I know that we understand, but for those of people that may stumble onto this thinking Alice is something else, can you explain the federal poverty level and New Jersey's poverty level? Because that is a little different. And people are always a little confused. So, for the layperson who would be
Absolutely.
stumbling onto United Way, thinking that it was a financial distribution and things, and then coming on and being like, oh, it's direct services. I can help, I can get some help, I can get some referrals, but do I meet the criteria? Can you explain a little bit more about
Sure.
Alice and what those federal levels are?
Yeah, yeah. So as we mentioned, the way the federal government really tracks poverty and determines eligibility for program services like Medicaid, SNAP, the housing voucher programs, all of the kind of supports that the federal government and really state government, offers is really benchmarked against this federal poverty level.
Mhm.
And that was something that was created under the war on poverty under President Johnson. It hasn't really kept up with
And
inflation. The tracking system is antiquated. Everyone knows it, yet we really don't have an effort in government to move away from it as the
mhm.
primary measure. So, for example, a family of four is considered to be in poverty if they earn under $29,000, regardless of where you live in the country.
Mhm.
But when you look at real wage and we look at kind of the top 20 jobs, for example, in the state of New Jersey,
Mhm.
retail, the care economy, frontline healthcare workers, paraprofessionals in the school district, kind of top 20 jobs, and then you match that with accurate, actual cost of living around housing and transportation and food and childcare, et cetera.
It's not clear. Yeah.
What we find is if a family of four earns under $98,000, they're
Mhm.
considered Alice. And so what we've done over the last 20 years, we have a National Research Advisory Council made up of over 300 research experts from all over the country that review our methodology every year. And what we've done is now what we look at folks who earn under that, for example, New Jersey, $99,000 for a family of four, and people who are in poverty, and that gives you a total percentage. So in New Jersey, and we just released our latest report in May, 39% of households in the state of New Jersey,
Wow.
1.4 million households in the state of New Jersey are either ALICE or poverty. And so when we talk to policymakers, business leaders, community activists, all of us, to understand who is struggling in our economy and in our community, that's who we're
40% of
talking
us.
about.
Mhm. And these are our employees. These are employees.
That's the other thing, Mariekarl, is we need Alice.
Yeah.
Like think about your day, right? You drop off your child
Mhm.
at childcare, you go stop in and see a loved one in an assisted living, you get coffee, you pick up your groceries, maybe you order dinner, your Uber, your DoorDash, whatever it is, we need Alice.
Yeah.
Like I always say, they're the maintainers of our economy, even with the AI, even with all of the kind of efficiencies that are coming, you still need the Alice workforce.
Thank you so much. That was such a great explanation because 1.4 million is astounding. 40% of our peers, our
Exactly.
neighbors are going through this. And that's not on the frontal lobe because when we think about poverty wage, we're thinking about completely different people, not the people that
It's
live next door that can be undomiciled by
that's
you know,
right.
one
Right.
one thing happening in their home. So when you talk about gathering the data for Alice, How does that come about? And what community organizations help you pour into you, and how can we help?
Yeah. So the data is based on publicly available data. It's
Mhm.
gathered, except for childcare, because that we don't have that on a national, on a state level data set available from the American Community Survey. We have a different source for that. But as I mentioned, we have a National Research Advisory Council, and
Mhm.
then we have coalitions at every state that are part of the ALICE movement that we staff and support and provide data for. So we have about 300 research practitioners who work with us every year to review our methodology.
Mhm.
And the methodology is based on the data from the American Community Survey. So really the census, but what's done annually.
Mhm.
And so that's something that is really important to us as a country, as leaders, as students of the economy. To have that data is absolutely critical. We see nationally, just a couple more stats to share. Nationally, we're talking about 42%. So it's 55 million households across the country is the national average. Um, I'm actually, New Mexico is the next state that's joining the Alice movement nationally. I'm flying to New Mexico next Wednesday to launch the Alice Coalition in New Mexico. And 46% of residents, citizens of New Mexico are either Alice or in poverty. Significant issues within the Native American community, as you would
Yeah.
imagine.
Mhm.
So it's interesting to see on a state by state basis.
Mhm.
We also have Hawaii that's part of the Alice movement. They're almost at 50%,
Really?
51%.
Wow.
Right. But you think about the hospitality economy and the shifts, the cost of living on an island. And so it's really we see what we see here in New Jersey is really a microcosm of what's happening across the country. And right, New Jersey, we tend to be leaders in a
Yes.
lot of this work. And
Mhm.
so we're really proud that our United Way gets to lead this national movement.
This is very, very exciting and quite shocking to me. And I know that you do this on a daily basis. What statistics have been most shocking to you?
Yeah, that's a great question. I think, we when you drill down at kind of the demographics of that in New Jersey, say 39% of households, Alice, in poverty, we see disproportionate impact in Black and brown households,
Yeah.
right, Carl? And we know that,
Same in
right?
maternal health. Yep.
And
Mhm.
and then when we look at children, and over 40% of Alice households have children.
Mhm.
Our latest report in May showed the largest kind of growing population of Alice are seniors, right? With our aging of America, and longevity is increasing. There's something that we're seeing a lot more seniors now who are working but are Alice.
Mhm. Wow, that's really interesting. One of the things that I thought about when you talked about the demographics, I know every year in school, when you go back to school, the Department of Education is always filling out the lunch vouchers. So does that play a role in the data that you collect also?
Yes. So the challenge though for
Mhm.
a child that's in an Alice household, they're typically not eligible for free and reduced lunch because the family income is like just above
Right.
the federal poverty level. And so, programs like we have here in New Jersey, where it's universal breakfast, universal lunch in many of our districts,
Mhm.
that really, Alice benefits from that. Alice children really benefit from that. As well as all children, right? Around
Right.
just the feeling of inclusion and all of the issues that are behind that,
Mhm.
making sure everyone is fed so that they can learn. But yes, you're right.
The- Now, so many things. I have so many questions. I don't even know if we have enough time. You're going to have to come back.
I
But
hope so.
um,
Yeah.
thinking about what's happening now with the federal funding, how much has that affected you, and how can we, as a population and people listening, really start to embolden and emblazon the policy work that you're doing? If you could talk about that.
Yeah, so we're like you, we're very worried, right,
Hmm.
Carl? Very worried. Um, we are primarily looking at the SNAP reduction, of course, because that is one program that Alice, depending on the income level, can receive assistance for. So we're worried about the SNAP reductions. Medicaid is a huge issue. We have a lot of Alice families who are have SSI, permanent disability status, and receive Medicaid. So we're worried about those folks. So I think we're watching, we're tracking, and we're really concerned kind of what the total kind of social determinants of health and kind of impact on our population health is going to be over the next 5, 10, 15, 20 years.
Mhm.
We believe, right, our team of economists, and we're very fortunate to have experts advising us, that percentage of Alice households is going to increase.
Yeah.
And, before you know it, we'll be up towards that, 50% mark, unfortunately, unless something very drastic happens to really shift
Mhm.
wage and our overall employment picture.
Yeah, I mean, when we're talking about this, it does sound very grim, but I know that the reports that you lead really makes a huge difference in the community support that happens. Can you talk a little bit about how your reports have really changed the paradigm and really spearheaded different changes?
Well, I think we certainly see a tremendous amount of utilization of the data in policymaking. So
Hmm.
we do have, and Governor Murphy during the pandemic benchmark childcare subsidy eligibility against the Alice survival budget. A lot of the county and local and workforce investment boards determine eligibility against the survival budget, not the FPL. And we have examples of that all over the country where the Alice survival budget is being used to
Hmm.
determine eligibility and create access. So that's something that's
That's
really
great news.
important.
Hmm.
But I think the other thing that's important to mention is not only are we talking about a set of data and tools and analytics, and I would love to come back to talk more about what we have available, but it's also really shifting the narrative
Hmm.
around who is struggling
Yes.
and what we mean by financial hardship. You said it right away. These folks are employed. These
Hmm.
folks are working. We need them.
Hmm.
And for a lot of people that you talk to, obviously you and I are in this space. We do this justice work every day, but for a lot of folks that don't live and breathe this work, it's eye-opening. They
Hmm.
don't realize that just because someone's working, they could be living in their car or they may not
Yes.
be having food for dinner.
Hmm.
So I think that shifting the narrative, building awareness,
Hmm.
helping people understand who we're talking about, that is a huge part of our mission. And then also connected to the narrative is kind of destigmatizing the shame
Yes.
and the guilt that comes with struggle and hardship.
Hmm.
I talk a lot about, I grew up in an Alice household. My parents struggled very much. My father immigrated here from India, a tremendous amount of debt, a lot of life change and challenge. My parents were really on their own. And my dad was supposed to go back and have the marriage and
Hmm.
do all those things. And that didn't happen. And my parents met and fell in love and got married, had a baby in 14 months, and they were on their own
Yeah.
in, the late 60s. And so, I know that what that stigmatized feels like, and I
Hmm.
know what my parents went through, and that's something I think about every day, whether I'm talking about the data or I get to sit down with a family.
Yeah. And thank you for sharing your own story about being in the Alice household, but also know the changes that you've seen from the very first report to now
Yes.
has been
Yes.
astounding. And there are so many good things. Can you just share some of those examples?
Sure, sure. So I think, one of the things that we have seen, especially during the pandemic, when we did have the CARES Act and some of the supports that were put in place, the increase around SNAP eligibility, et cetera, the stimulus, which
Mhm.
was basically a form of, guaranteed basic income. Essentially, it was
Mhm.
basically a guaranteed basic income pilot from the government. What we did see from those temporary assistance is that Alice was okay, maintained during the
Right.
pandemic, and that we didn't see, excuse me, drops in quality of life, and we didn't see the numbers increase the way they could have. So
Mhm.
I think that shows us that if we are able to put resources and really think about kind of systems level supports, life can be better for Alice. So we know what to do. We
Mhm.
just have to prioritize and get all of our stakeholders, our policymakers, our funders, businesses around us to help make it happen.
And talking about, and we were just talking about it before, how can we work closer together to ensure that we're moving our agendas to ensure that our communities are healthy together? Um, what can we do as community organizations or just people that are watching this and be like, I want to be able to help? What suggestions do you have? Who should we reach out for? Is it just speaking to our legislators? Like, what can we do? How can we really get involved?
Yeah, I love that question. And I think there are numerous paths.
Hmm.
Obviously, someone like you with a microphone and a very clear mission, speaking to legislators, your board, community volunteers is always the best first place to start. But for folks that are new to this, I invite people to check out our website. There's a number of ways to engage with us throughout that. And if you have questions about the data or you'd like to learn more, simply just send us a quick email, and we do a lot of data sharings, data briefings to help people understand, because folks are in many cases really not aware of the
No,
specifics.
they are not. I told you I was shocked by the statistics of 1.4, and I do this on a daily basis, 39%, which quantitatively, but qualitatively, you see this on a daily basis. And that report is so important. We are going to tag that on this so people can get some more information. Sorry for interrupting you. Go ahead.
Yeah, no. So I think start with, checking out the website. And then the next thing to do is, get involved with us, volunteer. We have a number of volunteer programs to help families directly. We just wrapped our school backpack to school supply distribution drive. We distributed over 6,000 school supplies to families in the area. We'll be coming up with obviously the gift distribution program around the holiday time. So there's lots of ways to get involved with us. Our free tax prep program, we have over 200 volunteers that help us do around 7,000 taxes annually. So get involved with us as a volunteer, come to an event. And we are also hosting a national summit conference this January in Miami, where we'll bring together about 700 Alice champions from all over the country. So my call to action is check out the website, ask questions, reach out to us, invite us in to whatever your community looks like, your religious affiliation, your neighborhood block, whatever that looks like, just so we can continue to talk about this and share information.
Absolutely excellent. We will do. You're invited to every single cookout. We're going to make sure that, when people are like, you're invited to the cookout, 100%, to make sure that people know what is Alice, what it stands for, how they're gathering information, and how you're really changing the paradigm within throughout the world, throughout the world, right? It's not only Northern
Yes.
New Jersey, it's really throughout the world. And I know we should be wrapping up, but I do have a softball question. You've done all of this work thus far. You have really changed lives, gotten quite a bit of awards and accolades. Um, if you were going to write a book, an autobiography, what would the title be and why?
Um, I've been doing a lot of reflecting, uh, being a leader this last year. I've been the CEO for 5.5 years, so I've done a lot of reflecting on my journey in this role. And I think perhaps I'd love to explore and research and interview other leaders and write a book around kind of that one superpower as a leader.
Mhm.
And I think for me, it's really learning to listen and listening to listen, not listening because I'm waiting to speak.
To respond.
Right.
Yeah.
And so I think that's, and I would love to interview you because, and you would be my
I'm there for
first.
you. I am there for you. It is just, it was such a pleasure to finally get down and dirty and speak with you and really to educate our listeners and our stakeholders about what Alice is and just learn these really shocking statistics. Um, the numbers do not lie. We see it on a daily basis. We help quite a few people, but the statistics are really jarring. And I look forward to working with you to change the paradigm. Thank you so much. And we're going to have you back because there's so much more to talk about with the data and to drill down and to make sure people understand who to be referred to, what stakeholders are out there helping, and the things that you're doing to help change the paradigm. Thank you so much. Really
Thank
appreciate your
you. Thank you.
time. Okay. And thank you for joining us for this edition of Partnership Live. See you next time.